of my friend Abdurrahman Al-Abyad. Thank you so much, Abdurrahman. um, so in this session, inshallah, we'll be talking about right atrial pressure and its relation with venous return, right atrial pressure and its relationship with cardiac output, and finally, right atrial pressure and its relationship with cardiac output times venous return on the same graph. So this is a very important lecture, and it gets asked about a lot in the exam. It's probably not going to be on. It's not only going to be examined in your midterm, but maybe also in your final. So there are some basic concepts you need to understand before getting into the lecture. The first one is that venous return. So what's venous return? It's the amount of blood that returns to the right ventricle of the heart. Okay, and cardiac output is the amount of blood ejected from the left ventricle of the heart. Okay, and therefore venous return equals cardiac output. And you can think of this in two ways. One is that you'll be ejecting the same amount of blood you got. So if you got 5 liters of blood to the right ventricle, you'll be ejecting 5 liters of blood from the left ventricle. That makes sense. Another way to think about it is that whatever you ejected from the left ventricle is what you're going to get back to the right ventricle. Okay. So in any case, in normal circumstances, venous return should always equal cardiac output. That's a very important rule to remember. And if it's not equal, then we have a problem in the body. Either there's a hemorrhage, some vessel is leaking, whatever. Okay. The second important basic concept you need to know is that cardiac output is affected by the end diastolic volume, preload, and the Frank-Starling law. So you took this in the lecture of cardiac cycle, or whatever lecture you took it in. That increase in preload will increase the cardiac output. Okay. So the end diastolic volume or preload is determined by venous return. So the more blood you get into the right ventricle, the more the end diastolic volume. And therefore, venous return is what determines the cardiac output. Okay, so they're not only equal, but venous return also determines the cardiac output. So increase in venous return will increase cardiac output, decrease in venous return will decrease cardiac output. So are these concepts clear? They're very important to remember for the rest of the lecture. Amor, you have a question?
Yes. Frank-Starling law, is it the one that's related to contractility, or what was it?
It's when the muscle of the heart is stretched more, it contracts stronger. It's not contractility,
Yeah,
they're not the same.
I remember that.
It's the more blood we have in the heart, the more we're gonna have stretching, and the more we stretch, the more the contractility is gonna increase. That's
It's
the
not
law.
contractility, guys. That's
Not contractility.
it's not the
The
same.
more we're gonna
Yes, the
contract,
contractile
the more
strength
we're
is
gonna
going to
contract.
increase.
My bad.
Okay.
Yeah. Yeah.
So
Stronger
now let's
contraction.
get into the first objective. I'm sorry, what was that? Say it again.
Stronger contraction, basically, right?
Yes, stronger contraction, exactly. So now the first objective of the lecture is the relationship between right atrial pressure and venous return. Okay. So first we need to understand two terms, central venous pressure and right atrial pressure. So what's central venous pressure? Central venous pressure is the pressure in the vena cava just before the right atrium. Okay. So it's the pressure in the veins just before the right atrium. Right atrial pressure is the pressure inside the right atrium. Okay. And in order for blood to move from the body to the right atrium, we need a difference in pressure, a pressure gradient. Okay. And what's this pressure gradient? It's the difference between CVP, which is central venous pressure, and right atrial pressure. Okay. So is this clear? Let me explain it on the diagram. Now, this is the right atrium. Okay. And this is the veins just before the right atrium. The difference between this and this is the pressure gradient needed for the blood to flow from the veins of the body to the atrium. Okay, so in this case, what's the pressure gradient? Anyone?
8.
8, exactly. Because the difference between central venous pressure, which is 10, and right atrial pressure, which is 2, is 8. Okay. Now, what's the relationship between right atrial pressure and venous return? Okay, so I'll show what determines venous return. We just said it in this slide.
Cardiac output.
Yes, but more precise, like another thing, directly. It's a pressure gradient. Okay, so the greater the pressure gradient, the greater the difference between central venous pressure and right atrial pressure, the greater the venous return. Okay, because we're pulling along a greater pressure gradient. Is this point clear? Okay, so what determines the venous return, as we said, is the difference between central venous pressure and right atrial pressure. Okay, so the greater the pressure difference, the greater the venous return. Now, therefore, at a constant central venous pressure, if we keep the central venous pressure at 10, for example, it's always 10. Okay, how will right atrial pressure affect venous return? Okay, so a decrease in right atrial pressure, what will it do to venous return if the central venous pressure is kept the same? Okay, yes, it increases, exactly. Why? Again, let's go back to the slide. We said this is the pressure gradient, which is this minus this. And the greater this value is, the greater the venous return. Now, if we keep this at 10 always, and we decrease this to, let's say, 0, then the pressure gradient goes from 8 to 10. So now we have a greater pressure gradient and therefore a greater venous return. Okay, so if we decrease the right atrial pressure and keep the central venous pressure constant, then we have increased venous return. And obviously, the opposite effect, if we have a higher right atrial pressure, then we'll have lower venous return. Is this point clear for everyone?
Yeah.
Yes.
So now let's plot it on a curve. Okay, this is exactly what we were saying, but on a curve. As you increase right atrial pressure, you decrease venous return. Okay, and why? It's because as you increase right atrial pressure, you are decreasing the pressure gradient. So this curve shows the relationship between right atrial pressure and venous return. As right atrial pressure increases, venous return decreases. And now this point where the venous return is 0, okay, it's called mean systemic filling pressure. I want you guys to forget about this point for now, and I'll tell you why it's significant later. But just the definition of mean systemic filling pressure is the right atrial pressure at which venous return is 0. And this has only one significance in this whole lecture, and it's a very important significance, but it will come later. Okay. Now, note this is
One
only.
second, but
Yes.
I got confused between the relationship between RAP and the venous return.
Okay. So let's go back to this diagram. We said what determines the venous pressure? The pressure gradient, or the pressure difference between this point and this point. Okay, this is called the right atrial pressure, and this is called the central venous pressure. Okay, so the higher the gradient, the higher the difference, the more the venous return. All clear until now?
Yes, okay, thanks.
Okay, so if this is kept constant at, for example, 10, and we decrease this, the right atrial pressure, will the gradient be higher or lower? Higher, and therefore the venous return increases. All clear? So now, this is if central venous pressure is constant. However, what happens if we change the central venous pressure? The curve will change, okay? And there are 3 things that can change the central venous pressure. Okay, one is blood volume. Okay, so let's think together. If we increase the blood volume in the body, will the central venous pressure increase or decrease? Anyone? Increase, exactly. Okay, so if we increase the blood volume, we increase the central venous pressure, and therefore we'll be increasing venous return and cardiac output. And if we decrease the blood volume, we'll decrease the venous pressure, and therefore we'll be decreasing cardiac output too. Okay. Now, the second thing we can change the central venous pressure with is venous compliance. Okay. So do you guys know what venous compliance is? This is part of your hemodynamics lecture. So does anyone know what venous compliance is? Okay, so I'm gonna assume you guys didn't study the hemodynamics lecture yet. So can you see over here? One of the special features of veins is that they can dilate and store blood. Okay, so the peripheral veins, the veins in your legs and your hands, they can dilate and actually store blood in them. Okay, so this ability to dilate and store blood we call compliance. So if I say that there's high compliance, then this vein has high ability to store blood, high ability to dilate and store blood. If I say there's low compliance, then this vein has low ability to dilate or stretch and low ability to store blood. Okay, so what happens if we decrease the venous compliance? What do I mean by decrease venous compliance? That means this vein has less ability to dilate, okay, and store blood. So there will be less blood stored, and so more blood will be reaching over here, and therefore will be increasing central venous pressure. Okay, so I'll repeat that again. Compliance is the ability of the vein, of the peripheral veins, to expand and store blood. Okay, so if we decrease this ability by decreasing compliance, then less blood will be stored in the peripheral veins, and more blood will be over here, obviously, because it has nowhere else to go, and therefore you'll be increasing central venous pressure, and therefore increasing venous return. So let's summarize that over here. Venous compliance, an increase in venous compliance will decrease ventral venous return. So that's just the opposite of what I said. If we decrease venous compliance, as in decrease the ability of the veins to store blood, then we will increase central venous pressure, therefore increasing venous return. If we, however, increase the venous compliance, which is increasing the ability of the veins to expand and store blood, then less blood will be reaching the central venous system. So the central venous pressure will decrease, and therefore decrease in venous return. Is this point clear? Okay. Now the third thing we can do to change central venous pressure is change in arteriolar resistance. Okay, so the resistance in the arterioles, because that's the site of control of resistance. And this is a very high yield question for histology, physiology, anatomy, everything. The site of control of resistance is the arterioles. Okay, an increase in arteriolar resistance will decrease venous return, and a decrease in arterial resistance will increase venous return. So both of these are inversely proportional with venous return, and this one is directly proportional. We'll go into more detail of arterial resistance in a bit. So let's talk about blood volume first, the first factor. So we said that an increase in blood volume will increase venous return. Okay, so which one? So this is the original graph. Which one do you think is the graph where we increased blood volume?
The one above it?
The one above it. Excellent. Why? Because as you can see here, at the same method, let's talk about the right atrial pressure of 2. At a constant right atrial pressure, which is 2, the venous return for this normal graph was 5. However, the venous return for this graph was almost 7. Okay, so which means we increased the central venous pressure. And this, the graph below is for lower blood volume. Okay, so an increase in blood volume would be an example of blood transfusion, for example, and a decrease in blood volume would be an example of bleeding. Okay, so I just summarized what I said over here. As blood volume increases, central venous pressure increases, and therefore the pressure gradient increases. As pressure gradient increases, the volume, the venous return will increase, and therefore the curve shifts upwards and to the right. Okay, and decrease in blood volume will do the opposite effect. It will decrease central venous pressure. The curve shifts downwards and to the left. And yeah, this is the final. All clear? Now, venous compliance. So which one of these graphs is for decreased venous compliance? Someone else, not Malak.
So if we decrease the venous compliance, I guess it's the upper also graph.
It's the upper graph. Why?
Because we are decreasing the amount of blood we can store in the veins. So we cannot store blood in the veins. We are pushing the blood. So the venous, the central venous pressure is going to increase, which is going to make a difference of gradient. So the venous return will also increase.
Perfect explanation, inshallah. Okay, so decrease in venous compliance means that we have less ability to store blood in the peripheral veins, which means more blood is going to come back to the heart, therefore increasing central venous pressure and increasing venous return, and therefore again the curve will shift upwards and to the right. And this graph will be for increased venous compliance. Okay, so as venous compliance decreases, once again, more blood flows to the heart, therefore increasing central venous pressure. The curve shifts upwards and to the right. The decrease in venous compliance increases blood storage in the periphery, and the decreases blood flow to the heart, and the curve shifts downwards and to the left. Okay. The nice thing about CVP or cardiovascular system physiology is it's all connected. So this lecture, for example, is very connected to the hemodynamics lecture. If you understand one, you understand the other. So if you have a big picture in your brain, then it all becomes easy. Okay. So now let's talk about arterial.
There's something wrong here. Decrease, it says downwards and to the left, and in the graph,
Yes.
you put the decrease one in the upward, right?
Oh, yeah. My bad.
I got so confused.
Good job. Well, I'll change it. Thank you, Amar.
Okay,
Can you see my
I'll-
slides? So now let's talk about arteriolar resistance. Now, this is the arrangement of the blood vessels in the body. We have an arteriole, then a capillary bed, then the capillary bed changes into a venule. صح? So let's say we increase arteriolar resistance by vasoconstricting. Okay, so obviously you guys know, you should know by now. No, you increase resistance by vasoconstriction. Okay, so let's say we vasoconstrict the arteriole. What will happen to the pressure in the venule?
Increase.
Omar says increase. Does anyone have a different answer?
Decrease,
Decrease. Why?
because we narrowed the arteriole, which means that less blood volume will pass because of the resistance, high resistance.
Excellent. Okay, so by vasoconstricting the arteriole over here, that means less blood is going into the capillary bed, and therefore less blood is going to the veins, and therefore we're decreasing the pressure in the veins. Okay, because there's just less blood volume. Okay, so increase in arteriolar resistance means constriction of arterioles, which means less blood flow into the venules and less venous return. Okay, now this is a $1 million question. What happens to the pressure in the arteries? So we said the pressure in the veins decreased. What happens to the pressure in the arteries?
It increases.
It increases. Excellent. Okay, so this is a very important concept. If I decrease or increase the pressure in the artery, that doesn't mean I did the same for the vein. Okay? You need to understand this concept very well. And this is also part of your hemodynamics lecture. If you constrict a vessel, then you're increasing the pressure in that vessel. So over here, the pressure is going to be very high. And over here, the pressure is also going to be high because blood is building up over here. And over here, it's just because the radius decreased. And this is an equation you guys need to know very well. If radius decreases, then the pressure will increase. Now, this is part of a hemodynamic lecture. It's not part of this lecture. So if you don't really understand it now, Adi, but I'm just giving you a concept that if you do something for the artery, that doesn't mean you're doing it for the vein. This is a point that I got very confused in when I was the first year. And you guys should keep aware of that, okay? So although we're increasing the pressure in the artery, we're decreasing the pressure in the vein. And now we understand why. Because over here, the arteriola is constricted, less blood is moving to the vein, and therefore the veins pressure will decrease. All clear? Okay. Now, what happens if we dilate the artery?
We increase the pressure in the veins.
Yes, we increase the pressure in the veins. Okay, so it's just the opposite effect. Since now we're dilating, more blood is going to the capillary bed and to the vein, and therefore higher pressure in the veins. Okay, and if you have higher pressure in the veins, then what does that do to the venous return?
Increases it.
Increases the venous return. Okay, so now let's summarize this on the curve. Which one of these curves is due to increase in arteriolar resistance? So this one or this one? Increase in resistance.
The one
I think
that's
The one
down.
The one that's below. Excellent. Why? Because when we increase resistance, less blood is going to the vein, less central venous pressure, and therefore less pressure gradient, and therefore less venous return. Okay? And the above one is obviously because of less arterial resistance, and I hope you all understand why by now. Okay. Now, did you guys notice any difference between this and the other curves we took?
the slope.
Okay, the slope is one.
There is
What's the
no
main?
difference. The right arterial pressure. It's on the same point.
Yes,
It requires
exactly. It's this over here. So if you go back, you remember when I was explaining the meaning of mean systemic filling pressure, and I said you guys can forget about it for now, but it will be of very important significance later, this point. If you notice, in these graphs, it changed. So if the graph moved up and to the right, this also went up and to the right, okay? And this, if the graph decreased, then this also decreased with it. That's in the case of blood volume and venous compliance. However, in the case of arteriolar resistance, it doesn't. It stays always the same. Okay, now the explanation for this, I'm not going to go into detail. I'm just going to say the simple explanation because if you go into detail, you won't understand. So I feel like if you memorize it at your level right now, it's better. But I'm going to give a brief explanation. So the mean systemic filling pressure only changes if you change the blood volume circulating in the blood. Okay, so when you're changing the blood volume, obviously you're directly changing the blood volume, and therefore you'll be directly changing the mean systemic filling pressure. And for venous compliance, because a lot of blood was stored, and now you're changing the amount of blood was stored, you're introducing new blood to the circulation. Okay, from storage, it came to the circulation, and therefore the mean systemic filling pressure is also directly affected. However, when you're playing with the resistance, you're not introducing any new blood to the circulation, and you're not removing any blood from the circulation. Whatever is there is there. Okay, you're just playing with the pressures of arteries and veins. So that's why the mean systemic filling pressure didn't change. Okay, so you guys don't need to understand why it didn't change, but you guys have to know that it doesn't change. You have to. Amor, you have a question?
Yeah, what you're always saying mean systemic filling pressure. What was that? What's that?
So mean systemic filling pressure is the point at which venous return is 0. So this point.
Oh,
So it doesn't change. even if you change the arteriolar resistance, and the graph will change, but this point doesn't change. And the other graphs, in the other two graphs, which is blood volume and venous compliance, it does change. This is very important, and you'll come to know that when you're solving for questions, okay? Does everyone get this point? Okay, so now let's move on to the relationship between right atrial pressure and cardiac output. Okay, so this curve is called the vascular function curve, and it's the relationship between right atrial pressure and venous return. Now we're introducing a new curve called the cardiac function curve. Okay, so now I need you guys to look.
Yes, he's still outside. One more is coming.
Just reply to her that yeah, we're outside. Waiting.
Yeah, I told him yes, he is out.
Sorry about that. Okay, let's go back. So we introduced the vascular function curve. Now let's introduce the cardiac function curve. Okay, so this is the relationship between right atrial pressure and cardiac output. Okay, so I need you guys to look from new perspective right now. What happens if we increase the venous return? What happens to the right atrial pressure?
It increased.
It increased. Why? Because you're having higher volume in the blood in the right atrium. Okay, so if you increase venous return, then you're increasing right atrial pressure. Okay, and if you increase right atrial pressure, what do you do to the end-diastolic volume?
It's also gonna increase.
It's also going to increase. Okay, and if you increase the end-diastolic volume, what do you do to the cardiac output?
It's gonna increase.
You increase.
Increase. Okay, so now we can make this link that we made from the beginning of the lecture, which is venous return determines cardiac output. Okay, so 1 second, guys, my laptop is acting off. Turn. Okay, so we were saying, so right now we came back to the link we made at the beginning of the lecture. Venous return determines cardiac output. Increasing venous return means high cardiac output, and it does that through this path. Okay, so as you can see here in this graph, increase right atrial pressure will increase cardiac output. All clear? Okay, so now this curve will only be affected by one factor. Okay, and that's contractility. Okay, and guys, it's very important to differentiate between contractility and contractile strength. They're not the same thing. Okay, contractility has a very specific definition, and that's it. That is, do you guys know what the definition of contractility is?
How much we can generate action potentials or contract in
Yes,
the
exactly,
stimulation.
and that's affected by
Tropic
sympathetic
drugs.
stimulation only. Okay, so if you increase the contractile strength by increasing preload, that's not contractility. You can't say I increase contractility by increasing preload. That's not contractility, that's contractile strength. Contractility, you can only change it by these three things. Okay, increase sympathetic stimulation, increase circulating epinephrine levels, which is basically the same as sympathetic stimulation, and positive inotropic drugs, which are drugs that stimulate the sympathetic system to increase contractility. Okay, and you can only decrease it by three things: decrease sympathetic stimulation, again, negative inotropic drugs, and one more thing is the decreased ventricular tissue, and this happens in severe myocardial infarction when your heart tissue is dead. That's why contractility decreases, because there's just less fibers. Okay, so always people confuse contractility with contractile strength. They say by increasing preload, I increased, by increasing preload, I increase contractility. That's wrong. You can only increase contractility by these three things, and you can only decrease it by these three things. Okay, and if you don't do any of these things, then you're not affecting this graph.
So again, what's the definition of contractility?
So as Tahman said, it's the amount of action potential generated within the muscle fiber. And if you have more action potentials, then the strength of the contraction is stronger. But that's not what's important about contractility. What's important is what causes it. The increase in contractility is only caused by increased sympathetic stimulation or inotropic drugs. Okay? And it all leads back to sympathetic stimulation, by the way. So epinephrine increases sympathetic stimulation. Positive inotropic drugs increases sympathetic stimulation. That's why they increase contractility. It has to be something that has to do with the sympathetic nervous system. Okay?
Okay, thanks.
Okay. So now, over here, the graph, this is the normal graph. Now, this graph moved up. It increased. So what do you think happened over here? What's the change that happened from here to here?
Contractility increased.
Contractility increased. Excellent. And over here, the contractility decreased. Okay. So increased contractility will increase cardiac output. The curve will shift up and to the left. Decreased contractility will decrease cardiac output. The curve will shift down and to the right. All clear? So the cardiac function curve is only affected by one thing, which is contractility. That's it. The vascular functional curve, which is for the venous return, it's affected by three things: blood volume, venous compliance, and arteriolar resistance. Excellent. Okay. So now let's link these two together, which is the most important part of the lecture, and this is where all the questions will be coming from. Okay. So if you plot the two graphs together, there will be an intersection point. Okay. And this intersection point is what we call the normal point. Okay, which is the right atrial pressure at which cardiac output equals venous return. Okay, so cardiac output, we said, must equal venous return. Okay, and there's only one right atrial pressure at which cardiac output equals venous return, and that's called the normal point over here, the intersection. Okay, there's only one intersection because there's only one point where cardiac output equals venous return. Okay, and this normal point will change with changes in the four things we mentioned: blood volume, venous compliance, arteriolar resistance, and these three are for the venous or for the vascular functional curve, which is this one. Okay, and contractility, which is this one, which is for this curve. Now, in order to determine the change, we need to determine two things. What curve will be affected? Is it the venous return one or the cardiac output one? And then we need to determine how it will be affected. Okay, so if the question said that there was a change in any of these three things, then which of the graphs will be affected or changed?
Venous return.
The venous return one. And if the question said that there's a change in contractility, then which of the which graph will change? The cardiac output.
Cardiac output.
Okay. So let's give examples of how we apply this concept. Now, these are simple examples. This is not how you're going to be asked in the exam. A patient underwent blood transfusion. What did we do?
Increase the volume.
Increase blood volume.
You increased blood volume. So which curve will change?
The ventricular
Venous return.
Venous return one. And which and how will it change? Will it go up or will it go down?
increase.
It will go up, so increase.
This is the final. So these are the original. The black ones are the original, and the red is the change. So only the venous return graph changed, and it went up. And this is the new normal point. And you'll notice that cardiac output also increased. Okay, so if we don't change the cardiac output graph, that doesn't mean cardiac output will not change. It will change because you're increasing venous return, then you'll definitely increase cardiac output. Okay. Now, another example, a patient was given a positive inotropic drug from him. So, again, what curve will be affected?
Cardiac output.
Contractility, which is
Cardiac output. And how will it be affected?
it will
It's
increase.
gonna increase it.
Activity.
So it will move up. It will move up like this. Okay, so this is the new graph. And you'll also see that venous return, because cardiac output and venous return are plotted in the same, they're the same thing. They're always equal. So if you increase one, you'll increase the other one. So here we didn't change the vascular function curve, which is the venous return one. However, we still increased cardiac output and venous return. Okay. So now this is what you're going to be asked about. Don't freak out, okay? This star represents the normal, which is if the cardiac function curve was normal and the venous return curve was normal, no changes, then this is the intersection point, okay? And then they'll give you a question and tell you what's the new point we're in. And the question will either include a change in one of the four things we mentioned. And then you need to trace and see where you will go. So if the question had a change in contractility, then you'll move onto either this graph or this graph, depending on is it a decrease or increase. Okay, so let's say decrease in contractility. Okay, so you move down to this graph. Okay, and then we'll see if the venous return curve changed or not. So if we say مثلا that you decrease blood volume, so you're decreasing the venous return. So right now we're at this venous return graph, صح? If we decrease blood volume, we're going to move down to this one. So from here, you're going to go here. And this is the answer, and point N. So this is how you're going to be asked about it in the exam. So let's practice, okay? Sympathetic stimulation of veins only increased. Only the sympathetic stimulation of veins, okay? So where's the new point of intersection? So let's take it step by step. What's the first question we ask ourselves? Which graph is affected? So which graph is affected in this case?
Cardiac
Cardiac.
output.
Let's think again. So
Vascular
there's a trick in
function
this
curve.
question.
Vascular function curve.
Vascular function curve. Why?
Because there's no contractility.
Compliance, I guess.
Excellent. Yes, guys, don't read the question very carefully. This is how a question is going to come in the exam. Don't see sympathetic and say, oh, contractility على طول. Read the full question, okay? It says sympathetic stimulation of the veins and not the heart, the veins, okay? And sympathetic stimulation of any vessel will lead to its constriction. So if you're constricting veins, what are you going to do to its compliance?
Decrease it.
Decrease its compliance. So what are you going to do to the venous return?
Also decrease it.
Increase.
Oh, increase
Increase
it.
venous return. Okay. And so which curve is going to be affected?
Vascular function
The
curve.
last one was red.
Vascular function curve is going to be affected. And how will it be affected?
Up to the right.
Yes, and up and to the right. Okay, so what's the new point?
Wait, how do we know whether it's G or F?
Look at the graph of G and look where it ends.
Mhm. I guess
It
it's
ends
F.
over here. It's F. I'll explain why in a minute. So the answer is F. Good job, Dahman. Okay, so increased sympathetic stimulation of the veins will cause them to contract. This leads to decrease in venous compliance. Therefore, venous return curve will shift upwards and to the right. All clear, guys? Any questions? Any confusions? Okay, so Omar, to answer your question, we said that the main difference between the curves that end over here in the same mean systemic filling pressure and the curves that don't, this one is for arteriolar resistance, and this one is for the other two, blood volume and venous compliance. Okay, so for this curve, for example, you can't know if it's venous compliance or blood volume. They both will have the same effect. But this one, you know for sure, is arteriolar resistance. That's the characteristic feature of changes in arteriolar resistance. It doesn't change the mean systemic filling pressure. Okay, so the way you differentiate between G and F, if the question said arteriolar resistance, then you'd go to G. But the question is talking about the venous compliance. So you go to F. So this is how they're going to ask you in the exam. Okay? Okay, guys? We'll move on to the next question. And obviously, there will be no change in cardiac function curve. Why?
Because we're not using contractility.
Yes, we're not increasing contractility. We're not doing anything to contractility. Sympathetic stimulation was only to the veins. Now, a follow-up question. If we say that if the question was sympathetic stimulation to the cardiovascular system was increased in general, so where would the graph go? So to the heart and to the veins. Where will the graph?
I guess point B.
A.
Or wait.
So yes, someone said A, which is correct answer. So we were here, but since now we said that the sympathetic stimulation is also to the heart, so we did increase the contractility this time, and we also decreased the venous compliance. So we go over here, okay, which is the curve of the cardiac function curve where the contractility increased, and the venous return curve where the venous compliance decreased. Okay,
So
move on
if
to
we
the next
don't,
question.
if we made it only like from the origin of the point, and then we just said sympathetic stimulation of the cardiovascular, it would be C, right? Or it's also
Yes,
C?
excellent. It would be C. Excellent, excellent. So you're getting the hang of it. Okay,
Wait,
so
how
this
do we
is
do it with C? What's the
so
case for?
he said if we only increase contractility of the heart and nothing else, where will the graph be?
Oh, that's easy. Yeah, C.
Okay, so this is a nice question. Herbal supplement advertised to enhance weight loss was found to increase cardiac contractility. So this is point number one, cardiac contractility increased, okay? And then it decreased arteriolar tone. So what does this mean? What does decrease arteriolar tone mean?
I think we're gonna decrease the arterial resistance, so vasodilate.
Yes, vasodilation. Okay, so if you decrease the tone of a muscle, you're dilating it. Everyone clear? So in the exam, this is how you approach the question. You first read the question and then either highlight or write down the main parts of the main points of the question in the paper next to you. Okay, because most of the question is going to be kharabit. It's just going to be stuff, useless stuff. The things that you need to know from the question are like 3 or 4 points. So in order for you not to get lost, because the words are so many, you have to either highlight them or write the points relevant to you and the separate piece of paper they give to you, especially in CVP. Okay, and then approach the question. Okay, so now we know that this drug increases cardiac contractility and causes vasodilation. 2 things. This supplement was taken by a healthy person with a normal cardiac output, venous return, and right atrial pressure. Useless piece of information. The effect of this supplement caused a shift from normal, which is the star over here, to what new point of the cardiac vascular function curve? Okay, so can anyone answer?
I want to ask a question. How did you know that what's arterial?
Say that again. Sorry.
How did you
How do we know what?
like how did you know that what is arteriolar tone?
Oh, you need to know this. It's just a medical term. They should have taught you this. Tone, a tone of a muscle is controlled by the nervous system. Okay, so if the nervous system increases the tone of the muscle, then it contracts it. If it decreases the tone, it relaxes it. And this is used for all smooth muscles in the GI, the cardiovascular system, everywhere. So you need to know the definition of tone. It's just if you increase tone, you contract. If you decrease tone, you dilate. Okay, that's it. So now you decrease the tone, so you vasodilate. طيب, Dahman, you want to answer?
Okay, I'll answer it. So we're increasing the contractility, and also we are decreasing we're vasodilating. So we're increasing the venous return too. I think my theory it's B, but I'm not quite sure.
Okay, so let's go step by step. Which curve will change?
Okay, we're gonna have the
I think it's D.
B?
And
I think it's D. Because if the vessel is dilating, so there's less pressure, so it's basically shifting down. And
no. If you're dilating,
B is up.
If you're dilating, you're increasing the pressure. Therefore, there's more blood and there's venous return, so it's gonna increase.
Okay, so let's take it step by step. First thing is which curve is gonna be changed. That's the first thing. Which curve?
I think both of them, because we're talking
Both of them.
we're talking about
Excellent. Yes, exactly. So we're changing contractility. So the cardiac function curve changed. And we're also playing with the arteriolar resistance. That's also of affecting the venous return curve. So both curves will change. Okay, so that's point number one. Now, how will each change? Let's go to contractility first. So how will an increase in cardiac contractility change the cardiac functional curve? Will it go up or down?
it will go up.
It will go up. Okay. So now this is a very important approach to these type of questions. If we go up here, then it's one of these points. And we can automatically eliminate I, H, G, F, and L, M. We can eliminate all of those. Okay. So it can only be A, B, C, D, or E. Okay. So now you went down from 10 options to 5 options. Now, on this, now what determines if it's A, B, C, or D, or E? They change in the other curve. So how does the other curve change?
Also,
Decrease the contractility.
It will increase as well.
Sorry,
Yes.
decrease the resistance. Sorry.
Again, it will.
We decrease
What will
the
it do to?
resistance.
Yes, in the arteries. So we vasodilated the arteries. So will the venous return increase or decrease? Okay, so let's go. It will increase, exactly. Let's just clarify this point again once more. Sorry. Over here, we explained that if we increase the resistance or vasoconstrict, then less blood will flow to the veins, and therefore we're decreasing venous return. And if we decrease the resistance by vasodilating, then more blood will flow into the veins, and therefore we will get more venous return. So in this case, are we dilating or are we constricting?
Dilating.
And therefore more venous return. Okay, so the curve will move up. Excellent. So, okay. Now we're at point C, صح? Because we eliminated the order and now we said that the venous return curve will move up. So we can eliminate D and E, صح? So how do we determine if it's A or B?
The reason why it's B, because we stated that we have systemic, there's a point
systemic filling pressure.
Yes, filling pressure. It's only an arterial, so it's B.
Excellent. Excellent. It doesn't change with arteriolar pressure. And this is the significance of this point of this lecture. You don't need to know why, you don't need to know how, but you need to know that it's the same in changes in arteriolar pressure, and it changes for changes in blood volume or venous compliance. Okay, so the answer is B. And as you guys perfectly explained, mashallah, both curves will be affected. And how will they be affected? The venous return will increase, and the cardiac function will also increase, and therefore we're at this point. So do you guys have any questions?
Yes.
Go ahead.
Why isn't it D? We said we are dilating the vessel, which means we are decreasing the resistance.
Yes. We're dilating which vessel? The arterioles.
Yes.
So we're decreasing the pressure in the arterioles, right?
Yes.
Okay. So again.
Yes. Okay. Can we go to the next slide?
Okay.
Yes. Okay. So here the one that's lower to the normal. This means that we decrease the resistance. Oh, it's increased. Okay.
Yeah.
Sorry.
Okay. No, it's okay. It's okay. It happens. Guys, this lecture can be, after you leave this pad, you're probably going to be a bit confused. So the only solution to this is practice questions and always approach questions in this way. First, get out what the question wants from you, the most important points, 3 or 4 points maximum. And then start eliminating options, and then you can pick the correct answer easily. Because if you don't organize your thought process, even if you know the answer, even if you know the concept, if you don't organize the thought process, you can get lost anywhere in between, and it will lead to a completely wrong answer. Okay, so do you got عمر تفضل.
Same right atrial pressure high. It means it's because the cardiac function curve has associated, right? So we don't change the mean arterial systemic
No.
something.
It doesn't have anything to do with the cardiac control. We said that if the arteriolar resistance changes, then there will be no change in mean systemic filling pressure. If the venous compliance and the amount of blood changes, then there will be a change in mean systemic filling pressure.
Yeah. I don't know why I always think about when it has to do with the cardiac function curve, so the mean systemic doesn't change. That's wrong. Okay, I got it now.
Okay, guys. So if you don't have any questions, thank you for attending. I know we went way over time. Sorry, but I hope it was beneficial. And good luck on your midterms. If you want, you can scan this code. Practice for this lecture. Practice as many questions as you can find, because practice makes perfect. And thank you, guys.
Thank you so much, Khalid.